In the spring of 2009, public health officials were alerted to an unusual outbreak of influenza.
Tuesday we reported that we had confirmed 2 cases of influenza that were swine flu in children in California.
On April 23, 2009, the CDC announced that this strain of influenza had not been seen before in the U.S. or anywhere in the world. It was a new strain of flu.
Today, Mexico's Minister of Health confirmed that they have cases of swine influenza in people, and that they believe some of the people who were infected died from swine influenza.
The world was confronted with a new flu virus to which it appeared no one had immunity. The potential existed for a severe pandemic. The public health community responded.
Last night, I arrived in Washington and immediately after my swearing in, met with officials from the White House to discuss the national response to the flu outbreak.
Yesterday we announced the release of material from our strategic national stockpile.
Currently, the FDA and Centers for Disease Control and Prevention are developing virus reference strains. HHS and the Food and Drug Administration will monitor the manufacturing of a potential vaccine and conduct strict oversight to ensure that the vaccine is safe and effective for use. As the vaccine manufacturing is underway, the NIH will also conduct clinical trials to make sure that the best dosage and formulation of the vaccine is available.
Over the last week, my administration has taken several precautions to address the challenge posed by the 2009 H1N1 flu virus.
Those precautions included disseminating public health recommendations through a variety of media and developing a candidate vaccine virus in less than 3 weeks. By June, there were 18,000 cases of H1N1 flu in the U.S.
WHO has officially declared us to be in a pandemic.
In July of 2009, scientists and public health experts from across the country came together in a pan-flu summit at NIH to discuss the most effective ways to minimize the impact of the H1N1 flu.
We're aggressively planning for a vaccination program.
The National Institutes of Health directed clinical trials of the H1N1 flu vaccine beginning in August. Trials were conducted on adults, children, pregnant women, and individuals with underlying health conditions.
I believe this is something that this federal government, in this administration, is doing correctly. And I hope that the American people will support the government and support their fellow citizens by getting immunization to the H1N1 virus in the order that they are supposed to take it, and will follow up.
HHS announced it was making $350 million available in grants to state and local agencies for pandemic preparedness resources and activities. HHS and the public health community continued to spread the word on not spreading the flu.
As I said when we saw the first cases of this virus back in the spring, I don't want anybody to be alarmed, but I do want everybody to be prepared. We know that we usually get a second, larger wave of these flu viruses in the fall, and so response plans have been put in place across all levels of government. For all that we do in the federal government, however, every American has a role to play in responding to this virus.
The FDA has licensed the H1N1 vaccine from 4 of the 5 manufacturers. We also have data now that there's a good antibody response to the vaccines.
So we are now up to 76 children having died from the 2009 H1N1 virus. To put that in context, the past 3 years, the total pediatric influenza deaths ranged from 46 to 88.
Although the production and delivery of vaccine was slower than hoped, 3 million doses of nasal spray vaccine were available in October as state and local agencies began holding H1N1 flu shot clinics. Media campaigns encouraged the public to get vaccinated and answered questions about the risks and benefits of the vaccine.
So talk about ingredients, some of these words that raise concerns.
Well, the main ingredient in the vaccine is a purified protein from the virus, okay? That is what stimulates you to have a response that can protect you against the virus.
If this H1N1 pandemic influenza virus had appeared in November or the beginning of December, we would have incorporated it into one of the components of the seasonal flu, and no one would be asking the question, is this a brand new vaccine for a brand new virus? Because the viruses change each year, and we change the vaccines each year.
In the month of November, H1N1 influenza was widespread in 48 states. People under the age of 24 accounted for 1/2 of flu-related hospitalizations. The number of vaccine doses available grew from 35.6 million to 54 million 2 weeks later. By the beginning of December, about 46 million people had been vaccinated, and states reported fewer new cases of influenza.
We're going from a time where there was lots of disease and not enough vaccine to a time where disease is gradually decreasing and we're having a steady increase in the amount of vaccine that's available.
Many people are still susceptible to this virus and would benefit from vaccination. We want to avoid complacency. Today, I'm happy to say that we have a very good supply of the H1N1 vaccine all around the country. Going forward, the H1N1 virus is still circulating in the U.S., and we expect it to continue to circulate for some time. We need to stay vigilant.
Current estimates are that 15% of the U.S. population has been infected with the 2009 H1N1 virus, resulting in some 265,000 hospitalizations and 12,000 deaths. Between 72 and 81 million Americans were immunized for H1N1 flu by mid-February, including 1/3 of all children. The close cooperation between federal, state, and local agencies that allowed an effective response to the 2009 H1N1 flu makes the U.S. better prepared to meet public health challenges in the future.